Dental crowns are a common dental procedure that helps restore the shape, size, and function of a tooth that has been damaged or decayed. While getting dental crowns can improve the appearance of your smile and overall oral health, it's important to understand what the recovery process is like. In this video, we will discuss what to expect after getting dental crowns and how to take care of them properly. What are dental crowns? Before diving into the recovery process, let's first understand what dental crowns are. Dental crowns are custom-made caps that are placed over a tooth to restore its shape, size, strength, and appearance. They are commonly used to protect weak teeth, cover dental implants, and improve the overall aesthetics of a smile. The recovery process. After getting dental crowns, it's normal to experience some discomfort and sensitivity in the treated tooth. This is because the tooth may need some time to adjust to the new crown. However, the recovery process is relatively quick and most patients are able to resume their normal activities within a few days. Here's what you can expect during the recovery process. 1. Pain and sensitivity. It's common to experience some pain and sensitivity in the treated tooth after getting dental crowns. This can be managed with over-the-counter pain medications such as ibuprofen. If the pain persists or worsens, it's important to contact your dentist. 2. Avoiding hard or sticky foods. To prevent damaging the dental crown, it's important to avoid hard or sticky foods during the recovery process. Stick to soft foods such as soups, smoothies, and yogurt until the discomfort subsides. 3. Brushing and flossing. It's important to continue practicing good oral hygiene after getting dental crowns. Brush your teeth gently with a soft bristled toothbrush and floss regularly to prevent plaque buildup around the crown. 4. Avoiding certain habits. To ensure the longevity of your dental crowns, it's important to avoid certain habits such as biting your nails, chewing on pens or ice, and using your teeth to open packages. These habits can put extra stress on the dental crown and may cause it to become loose or damaged. 5. Follow-up appointments. Your dentist may schedule a follow-up appointment to check the fit and placement of the dental crown. It's important to attend these appointments to ensure that the crown is functioning properly. Taking care of dental crowns. Proper care of dental crowns is essential to maintain their longevity and functionality. Here are some tips to help you take care of your dental crowns. 1. Practice good oral hygiene. Brush your teeth at least twice a day and floss regularly to prevent plaque buildup around the dental crown. Use a fluoride toothpaste to strengthen the enamel of your teeth. 2. Use a mouth guard. If you grind your teeth at night, consider using a mouth guard to protect your dental crowns from damage. Grinding can put extra stress on the crown and may cause it to become loose. 3. Avoid using your teeth as tools. Using your teeth to open packages or bite on hard objects can put unnecessary stress on the dental crown. Avoid using your teeth as tools to prevent damage to the crown. 4. Maintain regular dental checkups. Schedule regular dental checkups to ensure the health of your dental crowns and overall oral health. Your dentist can identify any issues early on and provide appropriate treatment. Getting dental crowns can greatly improve the appearance and function of your teeth. Understanding the recovery process and taking care of your dental crowns properly is essential to ensure their longevity and functionality. If you experience any pain or discomfort after getting dental crowns, it's important to contact your dentist. By following these tips, you can maintain the health of your dental crowns and enjoy a beautiful smile for years to come.